Hello everyone, today we will diagnose the disease. We are having a 50-year-old female which is presenting with fatigue, jaundice and pruritus. Jaundice is indicating the chronic liver disease and the duration of symptoms is 6 months. Now we will do the general physical examination which is indicating that the icterus is positive. LFT liver function tests are serum bilirubin levels is grossly elevated. Conjugated bilirubin level is also elevated. Liver enzyme SGPT is also elevated and ALP levels is grossly elevated, which indicates obstructive jaundice. Now we will do the ultrasound, which is a common bile duct is non-dilated. Now we will do the test of anti-mitochondrial antibodies which are present in this patient. So anti-mitochondrial antibody is a specific marker of primary biliary cholangitis, and the definition of this disease is in which the small bile ducts in the liver became injured and inflamed. So in this question we have markers for PBC, that is ALP and AMA. In this diagram we can see that the normal bile ducts and the inflamed and destroyed ducts. So here the bile ducts is non-dilated but obstructed. So now tell me in the comment section what is the treatment of PBC. Okay.